Less than a quarter of a century ago, medical conditions in China were, by any standards, utterly appalling. Today, I don't think anyone could travel in China, even in the remote areas, without feeling that the Chinese are among the healthiest people in the world. And this is especially true, of course, of the young people, those who were born since 1949. In the course of this program, I shall be talking to a doctor originally from America, who has lived for almost 40 years in China, and who had personally much to do with the establishment and development of the medical services available to the Chinese. China, of course, has not by any means overcome all her public health and medical problems, but to have established a medical service available to 700 or 800 million people, and in a country that was so poor and technically backward, is a very remarkable achievement. The courtyard of the Hospital for Traditional Medicine in Peking. The big sign is a quotation from Chairman Mao. It says, "Chinese medicine and pharmacology are a great treasure house. Efforts should be made to explore them and raise them to a higher level." 5,000 outpatients are treated in this hospital every day. The methods and medicines, very different from our own, have been practiced for many centuries. Traditional Chinese medicine relies a great deal, not only on acupuncture, but on a great variety of wild herbs and plants, which are not costly and grow in great abundance. The nurses call this our homemade computer. So many herbal prescriptions are prepared here every day that they worked out this ingenious way of automatically weighing and assembling the herbs. Literally hundreds of modern hospitals for Western-style medicine have been built in China since the revolution. Previously, Peking had only one modern hospital, used mostly by foreigners and upper-class Chinese. Today, there are over 40 new hospitals in Peking alone. Though not luxurious, they are well equipped and fully staffed. The national policy today is to break down the division between Western and Chinese medical methods. Some Chinese doctors trained in Western medical techniques still tend to look down on traditional medical practices as being unscientific. But these attitudes are changing, and you now often see doctors trained in Western and traditional medicine conferring on a case as they are doing here in a Shanghai hospital. All medical students now have instruction in both kinds of medicine. Here, the traditional doctor is explaining to the other the advantage of using a flexible splint rather than a plaster cast. Historically, it was China's enormous peasant population that stood most urgently in need of an adequate medical service. And in 1965, the main medical emphasis was shifted to the rural areas. Today, 75% of all medical graduates work in the country. Almost every commune or county now has at least one fairly well-equipped hospital with fully trained doctors. But these central hospitals could not possibly provide a medical service for all of China's 600 million peasants, many of whom live in widely scattered villages. In almost every village, there are now simple clinics such as this one. From among the peasants, young men and women are chosen to undergo a short period of intensive training at a central hospital. They return to their village, able to deal with all minor ailments and inoculations, and they know enough to recognize cases of serious illness, which are then sent to the commune hospital. There are now well over 1 million of these peasants, who are known as barefoot doctors. It's a picturesque name, but quite misleading, for I never saw one of them, or anyone else in China for that matter, walking barefoot. Medical services are now nationwide. Here, we are close to the Burma border, miles away from any city. Many different nationalities live in this area, and they still wear their native dress. This is a fully qualified doctor of the Han nationality. This man is a barefoot doctor of the Thai nationality. The cost to the peasants for medical services is very low. Most of them join a medical cooperative, and for 60 cents a year are fully covered for all medical costs. Family planning is widely advocated. Intensive education has brought China's population growth down to an estimated 2% per year. All birth control appliances and pills are supplied free. China's national goal is to stabilize her population. In every part of rural China, groups, under the supervision of a pharmacist, collect herbs from the countryside, which are brought to the clinic or hospital to be made into medicines. Most village clinics also have a pharmacy for Western medicines. But the medical advances in China cannot really be judged unless one recalls the wretched conditions of the peasants before the revolution. A century of exploitation by the Western powers and the invasion by Japan had brought the people to unimaginable suffering. Conditions of work, for those who had work, were often appalling. Rickshaw drivers had a working life expectancy of just 8 years. Uprooted by the war or driven by starvation, thousands of peasants flocked to the already overcrowded cities. For the millions who required medical attention, there were no doctors or hospitals or medicines. Even when floods brought widespread epidemics, the number who could be inoculated was small. A very remarkable American doctor, Dr. Maoist, has been in China since long before the revolution, and he has ever since been closely associated with the Chinese in building up the new medical services. He was especially involved with a nationwide program that finally succeeded in eliminating all venereal disease in China. I recently had a talk with him in Peking.
When I first went to the northwestern part of China, that is the Shanxi, Gansu area, it was in a period of civil war yet, and I was supposed to be the famous doctor coming in to cure all the illnesses. At that time, even there weren't any medical services in the countryside at all. None at all. And in the Red Army were the only ones providing any rural services, medical services at all. And those army doctors were trained in their own medical schools. They had to do everything from delivering babies to treating wounded, and with very, very little equipment. All our doctors were trained at a maximum of 8 months, and they served throughout the whole Civil War, the whole War of Liberation, with not more than a dozen actually qualified medical personnel. But the biggest problem was that the people were so undernourished, so tired, so worn out, that no matter what you did for them medically, you had to solve the problem of feeding them, really.
At that point, I asked Dr. Ma what happened after the revolution. The new government was faced with the need to do something for many hundreds of millions of people who had no organized medical services at all.